Hi, my name is Tiffany Wong, and I'll be talking about the relationship between individuals with obesity and COVID-19. So, obesity is defined as weight that's higher than what's considered as a healthy weight for a given height. About 93.3 million people in the US over the age 20 are currently obese. This is a condition that's linked to severe chronic diseases like type 2 diabetes, cardiovascular disease, and high blood pressure and cancer. These diseases are some of the leading causes of preventable or premature death. Obesity causes about 1 in 5 deaths in the US each year, and African Americans are the most prevalent for obesity, followed by Hispanics, whites, and then Asians. So BMI is body mass and it's or body mass index, and it's a screening method used for weight category. A BMI of 25 to 30 is considered overweight, and a BMI of 30 or higher is considered obese. So obesity is subdivided into 3 classes, and class 3 is categorized as extreme or severe obesity due to a BMI of 40 or higher. So this is the research article that I chose. It's titled Individuals with Obesity and COVID-19, a Global Perspective on the Epidemiology and Biological Relationships. And it was written by a number of researchers, as you can see right here. And the purpose of this study is to analyze the linkage of individuals with obesity and COVID-19. The study discusses topics from risk all the way to mortality. So for the method section, these researchers examined PubMed, Google Scholar, MedRiv, BioRiv, Wanfang, and other literature search engines. 75 publications that they found presented data on the BMIs or BMI categories of diagnosed COVID patients. All the studies were conducted between January and June of 2020, and it included 5 case control studies, 33 cohort studies, and 37 cross-sectional studies. The sample size included a total of 399,461 diagnosed patients in more than 10 countries in Asia, Europe, and North and South America, and about 55% of the patients were male. And these researchers used STATA to create meta-analysis and used residual maximum likelihood to fit all the models. Okay, so 20 studies assessed the association between individuals with obesity and COVID. All of the studies but 2 showed that individuals with obesity significantly increased the risk of COVID. A study used UK Biobank data to show that overweight increased the risk of COVID by 44%, with the relative risk as 1.44, 95 confidence interval at 1.08 to 1.92, and a p-value of 0.01. Since the relative risk is higher, individuals with obesity are more likely to be at risk if people are exposed. This study adjusted for age, sex, ethnicity, and socioeconomic deprivation, is measured by unemployment, assets, and household density. So socioeconomic deprivation kind of refers to the lack of material benefits considered to be basic necessities in a society. So the study only tested a small portion of individuals for COVID, and that was a limitation. So these researchers in the article found it better to calculate the odds ratio and compare the odds between subjects who tested positive and those who tested negative. Their data analysis showed that the odds of individuals with obesity being COVID positive was 46%, with an odds ratio of 1.46 and a p-value of less than 0.0001. Since the odd ratio is a big number and the p-value is less than 0.0001, This suggests that obesity is closely associated to being COVID-19 positive. Okay, so 19 studies examined the relationship between individuals with obesity and hospitalization. All the studies showed a significantly higher prevalence of individuals with obesity among hospitalized patients than among patients not hospitalized or the general population. The odds ratio was 2.13 and p-value was less than 0.0001. Individuals with morbid obesity significantly increased the odds of being admitted to the ICU by 74%. And morbid obesity is defined as BMI equal to or greater than 35. And it shows that patients with severe or critical conditions had much higher BMIs, and individuals with obesity prevalence than the normal population of or patients who were COVID-19 negative. As you can see, this table shows BMI distributions among COVID patients. Conditions were categorized as mild or critical, and the average is calculated on the side along with the national mean BMI data from the country of the study. If you look at these authors, they are from different countries, and so that's why you see that the national mean BMI varies on the table. If you look at the author named Argenziano, you can see that the average BMI for patients in this study who were in mild and critical condition is higher than the national mean BMI. But if you look at the bigger picture and you see a trend, more than half of the studies had averages that were above the national average, which shows that obesity is prevalent everywhere. Okay, so majority of studies showed that obesity significantly increased the odds of death among COVID patients with obesity. The pooled data from 35 studies showed that patients with obesity were more likely to have unfavorable outcomes with a 48% increase in deaths. And you can see the odds ratio is 1.48 and a p-value is less than 0.0001. So, hormone and nutrient imbalance in individuals with obesity can impair the response to infection. Uncontrolled serum glucose is shown to significantly increase COVID mortality, and it can impair immune cell function directly or indirectly by oxidants and glycation products. Dietary consumption of fatty acids can influence COVID in individuals with obesity. Omega-3 fatty acids can induce anti-inflammatory responses, while omega-6 fatty acids mediate pro-inflammatory responses. And in the US right now, there's a widespread consumption of omega-6 fatty acids, and those are basically the vegetable oils that we use to cook food. And also, physical features of individuals with obesity likely increase the difficulty of care in hospital settings for supportive therapies like intubation, mask ventilation, and prone positioning. So, obesity, or adults with obesity have higher burdens of mechanical respiratory therapy support and acute respiratory distress syndrome development. It's shown that men also experience a higher burden of COVID than women because being a man with obesity increases aromatase activity, which can convert testosterone to estradiol. So T cell production is critical for any future COVID vaccine, but T cell responses have been shown to be impaired in individuals with obesity. So a future COVID-19 vaccine may be less effective in a population with a high prevalence of individuals with obesity. It's important for vaccine trials and studies to include BMI as a potential confounder to make the vaccine effective for individuals with obesity. Okay, so COVID has led to increased unemployment, income insecurity, and changes in food supplies. In higher and middle income countries, access to fresh foods, especially fruits and vegetables, is impacted due to breakdowns in local supply chains and increase in the demand for packaged processed food. So McDonald's and Burger King, they're good examples of food that are ultra processed and have high saturated fat, sodium, and sugar. These foods, for the most part, are generally inexpensive due to the large scale in their production of fast food. And also, quarantining and fear of contact with COVID would likely have enhanced sedentary living. And sedentary living is like reduced walking or maybe more screen time on the TV, computer, and it's basically just an inactive lifestyle. So, in conclusion, individuals with obesity face a greater risk of severe consequences from COVID, including hospitalization, clinical care requirements, and death. Governments should consider actions to address economic issues and diet quality, especially during this time in a pandemic where we are encouraged to quarantine and comply with stay-at-home orders. Overall, I found that this research article had a lot of useful findings that help support the relationship between individuals with obesity and COVID. Um, when I first read it, it was a bit hard to understand because I originally thought that it would be one study, but these researchers gathered data from more than 1,000 studies and put all of their findings into this article. Okay, so this is the news article that I found from sciencemag.org, and the title is Why COVID-19 is More Deadly in People with Obesity, Even if They're Young. And it's written by Meredith Wadman. The beginning of the article opened as a story of an obese male who unfortunately died from COVID. And then the main substance after that of the article is a bunch of research and data discussing physiological and social factors that drive those obesity numbers up. Okay, so I thought that the mass media article did a really good job. They accurately represented statistics well with credible sources. They included the physiological aspect. The article mainly discusses about how people with obesity are far more affected with COVID, but it doesn't stress that COVID is indirectly affecting people's diets and weight gain. The journal article includes a section about how lower and higher income countries are impacted and how their diets may change, which contributes to the increased prevalence of obesity. This news article didn't really mention anything about income class, even though that's a big factor to account for with obesity. Overall, I think Jon Snow would give it a 5 out of 5 because the article gave a lot of information about the topics that were raised in the research article. And I like how the story in the beginning was told before data was brought up about obesity. I thought it did a good job at citing other credible sources as well so that the audience knows that the information that's being presented is accurate. Okay, so these are some discussion questions to think about. Do you think films that portray obesity are overly dramatized? Why or why not? Is obesity a disease or risk factor? What do you think? And what impact would labeling obesity as a disease have on primary prevention of childhood obesity? And this is my works cited.